Hey everyone, and welcome back to the channel. Today, we're diving deep into the world of dental hygiene with a twist. We all know the basics. Brush twice a day, see a dentist regularly. But what if I told you there are some small, science-backed tweaks to your routine that could make a massive difference to your oral health? These are the secrets your dentist wishes everyone knew! We've got a lot to cover, so grab your notebook and let's get started. Here are dentist-approved tips to optimum oral hygiene. Floss before you brush, at least once a day, especially at night. Do not forget to brush your tongue with either your toothbrush or clean it with a designated tongue scraper. Plaque adheres to the tongue and can be a source of bad breath. Rinse after flossing and cleaning your tongue. Wash all that loosened plaque away. Flossing helps clear away plaque where your toothbrush just can't reach. Imagine that the toothpaste can now flow into the space where plaque used to sit. After flossing, brush your teeth with toothpaste. Don't rinse right away. You want to use a modified Bass technique for brushing? This method will ensure you remove the most plaque. Don't forget to brush with a soft toothbrush! Medium and hard bristle brushes can wear away your enamel. An electric toothbrush is great. However, a manual toothbrush is just as effective if you brush properly. Make sure that if you're reusing an electric toothbrush, that you are letting it do the work for you. Avoid scrubbing your teeth with the electric toothbrush because it can wear away at your enamel. If you want to take it a step further, take a new piece of floss and smear toothpaste onto it, then floss that toothpaste between your teeth. Doing so can help prevent cavities where they typically start first, which is between teeth. Mouthwash isn't essential if you brush and clean between your teeth daily. But if you'd like to use mouthwash, do so after you floss and before you brush. This is your rinsing step. Let that fluoride-rich toothpaste sit on your teeth for at least 30 minutes to work its magic. Although fluoride is the gold standard for anti-cavity protection, if it isn't for you, try to use a toothpaste with hydroxyapatite. Some brands even have both ingredients. Don't eat immediately after brushing. Eating too soon can wash away that protective fluoride or hydroxyapatite layer. Don't brush right after eating either, particularly after acidic foods. Wait at least 30 minutes. Brushing too soon can wear down your enamel. All that being said, the oral cavity is the entry point to your body. Taking care of your teeth and gums can promote overall health by reducing disease-causing bacteria. Thank you so much for watching. I hope you found these tips helpful and that they empower you to take even better care of your smile. If you learned something new today, please give this video a thumbs up and consider subscribing for more evidence-based health and wellness content. Let me know in the comments which of these tips surprised you the most. Stay healthy, and I'll see you in the next video.